So today I'm going to talk about an update to treating MCAS or mast cell activation syndrome, and the there is no cure that I'm aware of except for the changing of metabolism, which I will talk about. There are three tools that I use for treating MCAS or calming it down. The first tool is low dose naltrexone, which is very, very helpful. Um, and then the second tool is Ketotifen. And both Ketotifen and low dose naltrexone are compounded medications. And the third tool that I use also is a compounded um, in the form of methylene blue. And what I usually do with folks with MCAS is that you need to start things one by one and go slowly. So if we do low dose naltrexone, I would say start low dose and build it up very slowly over time. And then Ketotifen, same thing, start at low dose and start it up um, and add it to the LDN. And then the third tool, the methylene blue, same thing. And anytime that you feel like you have crossed over, so let's say you start with 1 microgram and maybe about 50 micrograms, you can't go any higher, then I would add Ketotifen. And the dose is very, very individualized. And so I think that the best thing to do is to work with a knowledgeable physician in this field. And MCAS is one of the most challenging and most gratifying condition to treat. The last tool is a anti-inflammatory diet, and there's so many different ways of doing this. And I really think that again, it's better to work with someone or do the research and find out what anti-inflammatory diet would be most appropriate. There is no one way to do it. When I was younger in the journey, earlier in the journey, I was not wise enough to realize that the foods needs to be individualized, and sometimes even in the same individual, you have to change the approach as things change with the people. For example, the diets that used to work 3 years ago no longer are optimal for me, so I have to move forward with that. So I hope this video helps you to find a solution for MCAS. And if it's appropriate, if you are in Texas, Georgia, Florida, Illinois, or Missouri, contact me and see if I can be of service to you. Thank you. I appreciate you.